You have precipitated hypnosis. Despite assurances from other nurses that her uniform is quite in order, the particular nurse whom you appear to criticize will be certain that her dress is too long, too short, too small, too big, or that it bulges or doesn't bulge in the wrong or right places. And the longer she wears it, the more she will question her own judgment as to the uniform's fitness. When her ability to judge the uniform is sufficiently minimized, she will substitute what she believes is your considered judgment for her own. Without the aid of the trance state on a matter of selective thinking, you have bypassed her critical factor and implanted a hypnotic suggestion so firmly that she will only be satisfied when she changes uniforms. And having changed uniforms, she'll rationalize her actions by saying something like this: well, I never did like that old uniform in the first place. I was thinking of getting rid of it anyhow. But the rationalization has no basis in fact. The waking suggestion, which resulted in the waking hypnosis, did the trick. Ladies, the tape recorders are on, and I want to ask you, would that work? Answer out loud, will you please? Yes. Yes, of course it would work. And if any of you doubt it, try it. You'll find some amusing results. Now let's leave waking hypnosis aside for a little bit, and let's go back to waking suggestion, because here are examples of waking suggestion in dental and medical practices. Every man here in dentistry will tell you that he's seen patients like this in his practice. The patient walks into the dentist's office suffering the pangs of toothache. As he walks in, the pain subsides. He fears the dentist more than he fears the toothache. Soon he decides the tooth doesn't ache at all. The thought of the dentist drives the pain away. Gentlemen, you who are in dentistry, have you seen that happen? Yes. An accident patient is rushed to the hospital. He seems in bad shape. He's a mixture of shock and panic. In the emergency room, he hears the reassuring words, "Not serious, he'll make it, he'll do all right." And that instant, he begins to respond. Those magic words, "not serious," have probably saved thousands of lives. And those of you who have worked in the emergency rooms of hospitals have seen this happen with your own eyes and wondered why it happened. How many of you have seen things like this happen in the emergency room? Will you raise your hands, please? Look at the hands go up. Sure, you can't be in medicine without realizing that these things happen, and you wonder why. The waking suggestion did the trick. That's not waking hypnosis. That was waking suggestion. Conversely, the doctor says to the patient, "This is going to hurt a bit." And how true. The patient tenses up, and what should have been a minor procedure becomes an almost major one. Pain induced by suggestion. May I explain to you how this misunderstanding crept into medicine and manages to stay there? Every one of you, when going to medical or dental school, were informed by your professors, never take the patient by surprise. Keep them apprised of what you are doing at every step of the road. Never take the patient by surprise, say your teachers. But they don't tell you what to say to him not to take him by surprise. So the doctor takes that to mean, well, I should warn him of what I'm going to do. Well, I better warn him in an easy way. And so the doctor's way of warning him in an easy way is to say, well, this is going to be a bit uncomfortable, this is going to hurt a bit, but I'll try to go easy on you. And he thinks he's going easy on the patient, when as a matter of fact, he is making it about 10 times tougher for the patient if he but realized it. In the past 6 or 7 weeks, I don't think there's a man in class who hasn't seen how a change of words makes a change of treatment, not only in hypnosis, but at all other times in your offices. The right semantics. Instead of saying this is going to hurt a bit, say, well, now I have to do some work on your arm. I don't think you mind this. And immediately, the minor procedure is made so easy for the patient that he really doesn't feel it. So if you have to say something to the patient, make it easy on the patient. Lack of sympathy in psychosomatic ailments is frequently found to be a great cause of patient distress. The fact that his doctor has said, well, we can't find a thing the matter with you. Must be in your head. Must be in your mind. Causes patient after patient to feel that he is headed for insanity. And if you have taught psychiatrists, as I have taught them over the years, you will find them in class at this point saying, "Oh, Mr. Ellman, how true that is. Doctors send patients to us that way." That's the way they introduce the patient to the psychiatrist. And it means that we have to work about 6 months longer on the patient because of the improper introduction to psychiatry that the doctor has made to the patient. Sympathetic treatment of psychosomatic aches and pains gives the patient the necessary attitude to aid in his recovery. And there isn't one man in this area or any other who is in psychiatry who will not agree with that statement completely. Let's go back to waking hypnosis and show you examples of waking hypnosis in medicine and dentistry. There are a few doctors who have not found it advisable at times to administer, or at least order administered, the very common sterile hypo. How many of you have ordered sterile water hypos for your patients? Will you please raise your hands? Every doctor in the room, probably, and I think even sometimes in dentistry you do it. Do you use the sterile water hypo in dentistry at all? Don't, huh? All right. But in medicine, you have found it useful in a myriad of cases. Medicine has found it advisable to take one of the hypnotic techniques from hypnosis and has found it vastly useful over the years. It's a waking hypnotic technique. There are so many other things that medicine could have taken from hypnosis but didn't take, which would have also been vastly beneficial. For example, about the time that hypnosis went into its dark days, there wasn't a doctor in the 19th century, I guess, who didn't know this stunt that I'm going to show you now. This is probably the most useful adjunct to the doctor who meets up with a gagger. For if there are any gaggers in this room, and there must be in a room this large, there's usually people who gag like the devil, I would like to show you an almost magical recipe for stopping a person from gagging. Is there anyone who gags a lot in the dental office or when the physician has to examine their throat? Come on up, doctor. It'll work on you just as well as anybody else. Doctor, come up and examine his throat any way you want to and try to make him gag. Will you please, after I show him what to do? Hold that pencil like that, hold it tight, and you'll find you can't gag so long as you hold that pencil tight. Watch this. Make any examination you want to, you won't be able to make him gag so long as he holds the pencil. Have to go way back there to the... You have to go way back to the...
Tickle in the uvula.
That would make anybody in this room...
Further than anybody's been before.
Sure. Because by that time you'd have had it all over the lap, right? Sure. You use that, doctor, and I promise you that you can have dental work done, you can have medical work done. Just hold on to the pencil, that's all. Hold on to the pencil with both hands, and you have the nicest result. Now, I must tell you, those of you who do not realize that when the doctor went back there and touched the uvula, that there isn't a person in this room that would naturally gag at the touching of the uvula, and every doctor in this room knows it. But you who saw that happen, that he finally gagged when the uvula was touched, don't know if that's the trigger mechanism of nature to make you gag. So we haven't suggested away nature's trigger mechanisms, but we have suggested the trigger mechanism that in the past has made his uvula, or whatever it is, react long before the doctor got to the uvula area. And that, you must admit, we did completely. Isn't that right, doctor? Use that technique on your patients, and you will find that 97 patients out of 100 who gag will be benefited. Now, who are the people who won't be benefited by this little trick of waking hypnosis? But that's a hypnotic. Purely and simply a hypnotic. Who are the people who will not be benefited by the hypnotic? The person who gags because of a traumatic incident in their past. What do I mean by a traumatic incident? I mean something like this. A few weeks ago, one of the doctors, a psychiatrist, He says to me, Mr. Ellman, he says, my wife has a rare illness. I had to examine a lot of medical books before I could even locate what this illness was. But he says, I'll tell you how it affects her. She has no saliva. For 25 years, she hasn't had any saliva. And because of it, she got pyorrhea and lost all her teeth. She gets cracks in her lips that are so severe that they require medical attention. And he says, I finally located the name of the disease and the cause of the disease in a book written in Sweden many, many years ago. And so he mentions the name of the disease to me. I didn't mean anything to me. And I said, Doctor, nature must have had to manufacture some saliva over the years, or else she couldn't have lived, because she couldn't have digested her food, and she couldn't have lived without saliva for 25 years. Has that thought occurred to you? And he said to me, well, she manufactures very, very little of it. I said, well, whatever she manufactures must be in pretty good health, because otherwise she's been in pretty good health, hasn't she? He says, yes. I said, has it occurred to you that it might be on an emotional basis? And he says, oh, no, it couldn't be on an emotional basis. You see, after all, she's the wife of a psychiatrist. She has had psychiatric nurse training, so that I'm positive it isn't on an emotional basis. But he says, here's the reason that I'd like you to help her if you could. She can't wear her dentures because she doesn't secrete enough saliva. The dentures burn her mouth and cause irritations, and so after she wears them for maybe a day, she has to go 3 or 4 days without them, and then she puts them back in her mouth. She goes 3 or 4 days without them. He says, it's a pretty horrible plight that she's in. And he says, could hypnosis help her, do you think? And I said, yes, doctor, if you would let me investigate the cause of this thing, I think I might be able to help her. Now, 10 minutes of hypnoanalysis revealed this, that 25 years ago, she was an arrested case of TB. Her throat had been affected, but it was arrested. Now she had to have her tonsils out. And the doctors in that area in Europe refused to do the operation because they said they didn't want to take any chances on it. So they had to call in a specialist. The specialist was called from many miles away to do the operation. The specialist comes in, and she gets a notion that the specialist is coming at her with dirty hands. And so she says to him, Doctor, please, before you start the surgery, wash your hands. I can't believe that in this modern day and age, 25 years ago isn't so long ago, I can't believe that any surgeon in the world, Europe or elsewhere, would come at a person with dirty hands. So this began to sound sort of fishy to me right then and there. So she said, so I got him to wash his hands all right. And I can almost imagine the amazement of the surgeon as he went over and washed his hands. But now she had the notion that if his hands were dirty, his medical instruments must also be dirty. And now he comes at her with the instruments to remove the tonsils and so on. Well, the operation was a horrible one, to say the least. And after the operation, she was slow in making the recovery. But now, every time anything foreign came into her mouth, there was no saliva. Have you ever noticed that when you're afraid that your mouth gets awfully dry and you just feel awfully goose pimply all over and so on? And one of the common symptoms with many people of great fear is lack of saliva. Now, at the present time, I am of the opinion that she is abreacting to the tonsillectomy of 25 years ago, and that she has never had anything but an emotional problem arising from the fact that she's abreacting constantly anytime anything comes near her mouth, a foreign object such as dentures would at a level below conscious awareness remind her of medical instruments coming at her throat. And I'm positive we'll have complete results in that case, and she'll be able to wear dentures just as well as anybody else. The minute I succeed in giving her insight into where the problem stems from. But can you see how by her very story, she let me see that there was a traumatic incident there, and her husband, who, as I tell you, is a psychiatrist and a very able man, as I did this, and as I located the source of the trouble and found out that within 2 weeks after the operation, she already had the dryness of the mouth, said to me afterwards, he says, I never would have suspected that that could arise from an emotional problem. But that's how dental problems and medical problems arise. If you find a person who has had a traumatic incident such as that, you will find that that person, even though they hold the pencil, will not get relief from the gagging. But not more than 1 or 2 or 3 in 100 have had such a traumatic incident, and therefore you will find that the pencil will work beautifully in about 97 cases out of 100. It's strictly hypnotic, and I'll explain to you afterwards how we make these things work, because I imagine by this time the man in anesthesia is wondering, how the devil did he do that to me? The man back there who couldn't say his name is probably wondering, how did he do that to me? And probably the doctor in our very own class is saying, now wait a second, how did he anesthetize my jaw to give me better anesthesia than I had with chemical anesthesia? But I'll explain all that as we get to it. First, I want to make sure that you understand what it is that we're getting at. Many cases of impotence have been relieved by doctors who prescribe for their patients sugar pills, with the assurance this will make you potent as a young bull tonight. It is interesting to note that physicians and dentists use waking hypnosis almost every day of their lives, but are completely unaware of it. One of the intents of this course is to bring to the students' attention the scientific use of waking hypnosis. Now let me show you waking hypnosis at work in normal living. You're a child and you hurt yourself. You go running to mother who kisses you to make you well. Gee, every one of us has done that. And that is waking hypnosis at work. Every child in the world who goes running to his mother that way is being hypnotized. Waking hypnosis. Ever had this happen to you? Summertime, extremely comfortable, you're enjoying the weather tremendously. Someone comes along, whips out a handkerchief and says, wow, it's hot. Boy, is this a hot day. Oh, boy. And in a few moments, you are perspiring profusely. The temperature hasn't changed 1 iota. Nothing occurred to make you perspire other than someone sold you a bill of goods that it's hot, and naturally you react by perspiring. That is waking hypnosis. Have you ever been in a comfortable room, such a comfortable room that you're saying to yourself, gee, this certainly is just the right temperature in here, isn't it? Then a little bit later, somebody will come in and, it's cold in here. Ooh, get somebody to send up the heat. See, and you say, no, it's quite nice. But in a moment or two, you're quite willing to agree with them. You say, hey, it is getting cold in here. Let's get them to send up some heat. The temperature of the room hasn't varied 1 iota. But just as someone sold you a bill of goods that is hot, now someone sold you a bill of goods that is cold, and you react by wanting more heat sent up. The temperature hasn't changed. Temperature change didn't cause it. Waking hypnosis caused it. Ever been to a county fair watching the barker drum up trade for his carnival show? After the barker spiel, the shill leads the way to the box office. Notice the number of people who follow? Those followers are feeling in turn the power of waking suggestion and waking hypnosis. Although none of them know it nor would admit it, they are being hypnotized into buying tickets. We've all seen that at county fairs. You'll see it right here in town. Go to a movie sometime, or go past a movie sometime. You'll see a lineup at the movie theater. Did it ever occur to you that some theaters hire shills because attendance at movie houses have dropped off, and all these people are supposed to do is to stand in line and buy tickets? And because a line forms behind them, then they get out of the way, and then when that line starts to fade out, the 3 people get in line again and buy tickets, and that's their job all day long. Attendance in movie houses has been increased tremendously by this device. Did you ever attend an auction? Bidding is hot and furious. An item is put on the auction block that you could do very well without. Suddenly you find yourself bidding. The bidding goes beyond the value of the article, but you're still in there pitching. $5, $10, $20, $30, $50, $100. Before you know it, the bidding has gone far beyond the value of the article. You finally succeeded in buying it and bring it home only to learn that if you'd really wanted whatever it is, you could have bought it at the local store for half the price. That is waking hypnosis. And any time you go to an auction, beware of waking hypnosis because, brother, they can bypass your critical factor so fast at an auction that you don't know it's happening to you, and all of a sudden you're in there bidding. How many have come home with diamond rings from the boardwalks at Atlantic City and places like that? How many of you have really done it? I know I've been victimized at auction places. How many are willing to admit that they have been? Nobody? Wow, two brave men. Two brave men in class, and I saw a woman's hand go up back there. You have. Remember, waking hypnosis is responsible for that bypass of the critical factor. And in every case mentioned, notice how the critical factor of the human mind has been bypassed and substitute judgment used. For example, let's take the auction. Somebody says $5. Well, you know darn well that item is worth $10. So you say $10. Now the other person says 15, and you say, well, if it's worth 15 to him, it's certainly worth 20 to me. 20. Now he says 25. And by this time you're imbued with the spirit of the thing, and before you know it, you've gone up to $50 or $60, and suddenly you realize, hey, wait a minute, I only meant to go 10. The critical factor of the human mind is bypassed and substitute judgment used. You're using the judgment of the other person, the judgment of the auctioneer, who still acts as though he's giving you a great bargain at whatever price you get it. Now, if there is such a thing as waking hypnosis, if it was possible for me to get anesthesia on the anesthetist and anesthesia on our doctor in class back there, if it was possible for me to give the doctor back there amnesia for a few seconds, I must have known what I was doing. There must have been a method to my madness, because after all, I can't afford to make mistakes very often. Wouldn't I have looked like a silly fool if the anesthetist had come up here and he didn't have anesthesia? Now, he didn't know it, but there wasn't a chance in the world of his not having anesthesia when he came up here. Do you know why? Let me explain to you just why he got the anesthesia now. In the first place, he's probably heard from the doctor who brought him as a guest tonight that Dave Ellman is not considered a fool, and that most people give him credit for being fairly intelligent. At least I think they do. If I make the statement that I am going to anesthetize a man before a group of people, I would look like a terrible fool in front of all of you if he failed to get the anesthesia. Those were the exact thoughts which ran through his mind. Wouldn't he be an idiot to say I was anesthetized if I wasn't anesthetized? He must know what he's talking about. I must be anesthetized. Therefore, he locked his mind around the idea that he was anesthetized, and he was anesthetized. It happened as simply as that, Doctor. That's the full and complete explanation of it. But why did the man back there get complete amnesia for a few seconds? Simply because he liked the idea of that happening. He said to himself, wouldn't that be interesting if that really happened? And you ask him, that's exactly what happened. He didn't have to have amnesia, but he had amnesia because his mind said, gee, that would be a nice thing to have happen. I'd like to see what the effect was like. And the minute he thought that, his critical factor was bypassed, substitute judgment used, and he had amnesia. Is that correct, Doctor? Sure. And why didn't it happen to the other man? Because he sat there or stood there saying to himself, I'm not going to let it happen, I'm not going to let it happen, I better watch myself, I better watch myself, and therefore his critical factor wasn't bypassed. And it's as simple as that, and if you ask him the honest truth, he'll tell you. Isn't that so, Doctor? Sure, sure. Now, the teacher has to know these things. The teacher has to know these things. But if there is a way to attain waking hypnosis, and there must be, for I don't miss very often with it, and my doctors don't miss very often with it, They must know what they're going to do and set out to do it and succeed in doing it in order to achieve waking hypnosis. Well, let me show you what they must do. The mind of the subject must lock itself around a given idea. The crying child is certain that if mother kisses her, the pain will disappear. The nurse is certain the judgment of the doctor concerning her uniform is infallible. The people present at the egg experiment are certain that the first person who passed judgment on the egg was correct. The anesthetist was darn certain that I would look like the biggest fool in the world if he wasn't anesthetized, so he was certain in his own mind he was anesthetized. His mind had locked around the idea, and therefore he had the anesthesia. In order to attain waking hypnosis, you must lock the mind of the subject around a given idea. To cause the human mind to lock around a given idea, suggestions must be, in the waking state, must be given with complete confidence and absolute assurance. They must leave no room for doubt. If doubt creeps in, the suggestion usually becomes ineffective. Therefore, give the suggestions in a manner that implies that what you have said is as certain of happening as the dawn. Leave no room for doubt. And believe me, I left no room for doubt. And therefore, it happened. Now, I want to show you what it feels like to have your mind locked around a given idea. Let's start with you in the corner there. Doctor, I want you to put your hands together like that, and I'm going to count to 3. And at the count of 3, I want you to lock your mind around the idea that you can't get your hands apart. You 3 men in front, try this, will you please? Now, lock your mind when I count 3 and snap my fingers, and then you can do anything you want to try to get your hands apart. But lock your mind around the idea that they won't come apart. 1, 2, 3. Now lock your minds. Now try to take your hands apart and see how helpless you are. Try hard. Try hard. They just won't come apart. See that? All right, now they'll come apart. Unlock your mind. Did you feel that lockage? Did you feel it? Sure. Now, let's just try over here. I'm going to show you an odd effect. The 3 of you now. I want you to take your feet off the floor about that far when I tell you to, not before. And now you know that taking your feet off the floor is an awkward position. Lock your mind around the idea that you can't make your feet reach the floor. When I count to 3 and snap my fingers, and you'll find that you can't make your feet reach the floor. Now, when I say lift your feet now. Now, lift your feet. Now, 1, 2, 3. Now lock your mind. Now try to make your feet reach the floor. You can do anything you want. You can't make them reach the floor. Try hard. Try hard. It's absolutely impossible. All right, now unlock your mind and reach. Did you feel the lockage of the mind? Did you all feel it? Now, let's take it over here. Let's take about 3 of you together here, because I think that's the best way to do it. I want all of you to cross your legs. Oh, no, wait. Here's even a simpler one. Uncross your legs. Keep your feet on the floor. At the count of 3, I want you to lock your mind around the idea that you can't move your feet off the floor. Then do anything you want to try to get your feet off the floor, and you'll find yourself powerless to move your feet. Now, 1, 2, 3. Now lock your mind. Now try to get your feet off the floor. Do anything you want to get your feet off the floor, and you'll find they won't come. Try as hard as you want to. Try as hard. You feel that lockage? All right, now you can unlock your mind. You feel that lockage, gentlemen? This lockage that I'm talking about, anyone can feel if they want. Let's take the second one. I see you both have your hands together. Let's try that one. There's 3 of you there. I'll save you for over here. At the count of 3, try to take your hands apart. Let's see. All of you cross your legs. I'll give you 2 things to do at once. Now, at the count of 3, try to uncross your legs and try to open your hands. And you'll find that you can't do either one if you lock your mind around the idea that it can't happen. All right. 1, 2, 3. Now lock your mind. Now try to uncross your legs. Try to get your hands together. See how powerless you are. Try hard. Try as hard as you want. Try as hard as you want. All right. Now, try to uncross your legs, too. Now, unlock your mind regarding your hands, but keep your mind locked regarding your legs, and you'll find that you can open your hands, but you can't move your legs. Try your legs now. Now try your legs, doctor. All right, see, he didn't lock his mind, so they're good. All right, now you can unlock it. Now you can unlock it. Could you feel the lockage? Now, he had the mind locked up to a point and then unlocked. At first you had it locked, doctor, then you unlocked it. you can feel the lockage. Is that right, gentlemen? Can you feel it? Huh? Can you feel the mind lock?
Feeling his eye closed.
That's it. It's exactly like eye closure. He's got it perfect when he says that. Yeah, can't do it. It's the very same thing. Let's try it over here, gentlemen. You try it. There too. Now, first uncross your legs, because I'm going to do just the opposite now, and keep your hands apart. Try to get your hands together and your legs together. When I count 3 and snap my fingers, lock your mind around the idea that it can't be done. All right, now 1, 2, 3. Now lock your mind. Now try to get your legs together and your hands together. You'll find that you can't make your legs move or the hands move, no matter how hard you try. Feel that lockage? All right, try to get them together. Okay, can you feel that lockage?